ccsradio.com. And well, I should have asked you this before, but we'll ask it now. Carolyn, how do you pronounce your last name? Silly me.
Mercure.
Just how it looks.
It's difficult to pronounce.
Our conversation with Caroline or Caroline?
Caroline.
See, that's a Brian Regan bit there. He talks about the difference between Carolyn and Caroline being spelled the same. Brought to you by Marcus and Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus and Mack, a law firm representing injured people. Caroline is with IRMC Dermatology, based at IRMC at Chestnut?
Yes, Chestnut Ridge facility.
Beautiful.
Yep.
Beautiful. All right. And you've been there how long?
I started in June 2023.
Oh,
yeah.
So 6 months or so on the job there, huh?
Yeah, it's going good.
How do you like it?
I love it so far. So
Really?
I initially started in pediatric primary care when I first graduated. So I worked in peds for a while, and then I made the transition to dermatology, and I'm pretty happy. I like it a lot.
What made you want to switch?
I have always liked dermatology, but it's a tough field to break into as a new grad. So the opportunity just kind of fell into my lap. So it's very exciting.
So your education came from Seton Hill.
Yes.
I'm interested in the disciplines that you learn that enable you to switch from one area to something that seems unrelated.
Exactly. And that's the beauty of being a physician assistant. We are trained in all fields of medicine. So when we graduate, we're not limited to a certain specialty. We can pick and choose. Usually there are fellowships offered too. So if there's a specialty that you would really want to go in, they offer fellowships where you can get more training out of school and work closely with a supervising physician. But that's the best thing I think about the field is you have a lot of lateral mobility.
Did you do that when you went into dermatology? Did you go for the extra training?
I did train for a good 6 months before I started seeing my own patients with Dr. Wilson, and she is incredible. So it's been a wonderful learning experience.
She brings some energy to the job, doesn't she?
She does. She's the best.
IRMC Dermatology, located at IRMC at Chestnut Ridge, and we're talking to Caroline Mercure today about what she does there as a PA at dermatology. What are some of the things that you treat? Yeah,
we see a wide range of conditions. So in dermatology, we're treating hair, skin, and nail disorders. So that can be anything from acne, rosacea, to cysts, moles, skin cancers, melanoma. So we're seeing a wide variety of conditions and patients of all ages. So I still see pediatric patients, and I'm working with the adult population as well too.
I bet you there are times though when you say, boy, I wish people would come in just for a routine maintenance because the things that we encounter every day and the ways that we can protect ourselves, they're really, really important.
They are, yeah. And especially in the winter time, I think a lot of people are coming in with flare-ups of eczema and psoriasis. So we do see certain conditions that tend to worsen in the winter because of the colder months. We have that lack of humidity. So our skin barrier is disrupted because we have lost that moisture. So that essentially leads to dry skin, itchy skin, a lot of symptomatic things.
Yeah, wintertime skin is sort of like a rhinoceros skin.
Yeah, that's a great way to describe it.
It's all flaky and everything. I happened to look the other day, and the reason I looked was because it seemed like it was snowing, but it wasn't. It was just my forehead falling off.
Yes, yep, that happens.
We need to moisturize.
Yes, we need to moisturize. So in the wintertime, it's important, especially in this cold weather right now, when you're outside, bundle up. So wear your gloves, wear your scarves, wear your hat. Your bare skin exposed to the cold air does not help. Using a good body wash is important too. So a lot of patients will ask me what we like in dermatology, and I'm usually just recommending a plain old Dove bar soap. So keep it simple. Yeah. And then as far as moisturizers go, you are wanting to use something that's a little heavier in the winter. So you go to the pharmacy or the drugstore, and there's a ton of different options. It can certainly be overwhelming, but typically we like creams better than lotions in the wintertime because they're thicker. So lotions have more of a water base. Creams are more oil based.